Good day to you all, and I'm Dr. Nina Sioson from the Nutrition Management Services of the Medical City. And I've been tasked to talk about trying to see if there's any truth to any of the diets and the food choices that we make that may be safe or maybe not safe for those of you who have diabetes. Some of the common questions that are asked of me when they regarding food is, all of these fad diets, would they be good for me? Because I want to lose weight and I want to control my sugar. Always, it has to be a team effort. Anything that you're going to go into, venture off into in terms of a diet, will have to be coursed through your doctors. And if your doctors are going to be allowing it, then we have to work as a team. So we've also come across a lot of problems with especially your ketogenic diets. Remember that with a ketogenic diet, you bring down the sugars and then you ramp up the fats. Remember that just because you're bringing down your carbohydrates doesn't mean that as you bring up the fats, that your sugars are going to be controlled. Remember, they also can be converted into glucose in the blood. So you have to take note, and we've seen also some patients go into complications, which we call DKA, when they go into ketogenic diets. Plant-based diets are actually very good. We've seen time and again that actually the healthiest diets are those that are high in fruits and vegetables. But remember that just because you have a plant-based diet doesn't mean that your sugars automatically are going to be controlled. We have patients also that eat so much sugar, because remember that sugar comes from sugarcane and they think that it's safe because it's plant-based. So it still is about balancing all these nutrients, carbohydrates, proteins, and fats put together, even if you're using plants only. A lot of my patients and a lot of my colleagues talk to me about fruits. And actually, we do add fruits to the diet of most of our patients, but that really depends on whether your sugars are fairly controlled or not. We do get cases also wherein sugars completely are taken out as much as possible, including natural fruits, including natural sugars. Fruits are still good because it's a good source of antioxidants as well as fibers, which can also be contributory to health. But remember that when you take your fruits, you have to take it in small amounts throughout the day. If I were to advise you to take 3 fruits per day, it doesn't mean taking it all in one go, all in the morning, because you want to eat you want to eat all of it in the morning. So you take it one time together with meals as well, because you don't want to take your fruits alone, because the sugar content, it becomes easier to absorb when you take it on its own. But remember that they may be healthy in general, but they can be packed in with a lot of fruits and vegetables as well. Again, here we go with the fruits. So you can do the juicing aspect, but again, subdividing it throughout the day. Furthermore, also, you don't want to detox the whole day with just juices, because you can go into dehydration. We do have patients who get a lot of diarrhea from it, and then they become dehydrated, and that can complicate your diabetes as well. People ask me about, Doc, how much milk tea can I take? How much sushi bake? And then here, there's a whole list here, 10 items. Salted egg chips, okay, and which I love as well. How much of it is allowed? And especially in this lockdown, people have been baking left and right. And I think, the bakeries are going to be ballooning as well. These things are hard to answer. It depends really on how well your sugars are controlled. I don't like restricting too much the diet of people. There are some people who are thin and yet their sugars are very poorly controlled, and that doesn't mean that I can allow them to take the ube pandesal left and right. And I won't be able to say whether it's once a day, once a week, once every 2 weeks. It really depends on the overall diet pattern of an individual. So bottom line, when you're going to decide on what you want to eat, or if you're going to change your diet, or if you're going to go into a certain diet regimen, always disclose and ask advice from your medical professionals. The Diabetes Center is there for you to work as a team. We don't do it individually. We work all together with our nurses, our psychiatrists, as well as our medical experts. And we hope to see you there and answer your questions. I'm sure you have more questions to ask us, and we'll be happy to answer for you.